Good morning. My topic for today is about health assessment. What is health assessment? Health assessment What is health assessment? Health assessment is systematic and continuous collection, validation, and communication of patients' data, where data reflects how health functioning is enhanced by health promotion or compromised by illness. How could we attain this health assessment? We could attain it by subjective and objective data. Subjective data comes from the primary source, and objective data comes from secondary source, or that is your overt data. This is to identify and group significant data and to communicate this information to other members of the health team. When we are going to gather data, it must be complete, accurate, factual, and relevant. So when talking with subjective data, it is being said by the client himself or herself. While when we are referring to objective data, these are the data being observed by the nurse. And what is observation? It is the conscious and deliberate use of your five senses in gathering data. And while interview, this is a planned conversation. What are the purposes of this health assessment? This is to obtain a baseline data as a basis of the different changes that may happen to a client in the course of treatment, to focus on the problem. Screening device for the treatment. For the examiner, the nurse must have to know the normal physical characteristics and recognize deviations from normal. Another purpose will be to supplement, confirm, or refute data obtained in the nursing history. This is also to confirm and identify the nursing diagnosis. And another purpose is to make a clinical judgment about a client's changing health status and management. And this is also to evaluate the physiological outcomes of care. I would like to differentiate that assessment with the evaluation. In evaluation, you are determining the effectiveness of treatment or care. Treatment or care is being reviewed. The client's response to intervention is identified, and a consideration as to whether the client has achieved the predetermined outcomes and goals. This also includes the appraisal of the client's compliance with the health plan. In preparation for this health assessment, what are the things that you're going to do? You should introduce first yourself, and then you have to verify the client's identity but by asking his name or her name. You tell the client what you're going to do and the importance of it and how the client can cooperate. And prior to it, we have to perform hand hygiene and observe appropriate infection control procedures. You should also have to provide privacy for the client, after which we have to monitor vital signs. With the vital signs, we have the temperature, which is the average temperature is from 36.8 degrees Celsius to 37.5 degrees Celsius. Orally, the normal range will be 38.6 degree Fahrenheit, or that is equivalent to 37 degrees Celsius. Per axilla, it is 97.6 degree Fahrenheit, and that is 36.5 to 36.6 degrees centigrade. To rectal, it is 99.6 degree Fahrenheit, or that is 37.4 to 37.5 degrees Celsius. Talking of the pulse rate, we should also have to note down the strength, the regularity, and the bounding. For adolescence to adulthood, the normal pulse rate will be 60 to 100 beats per minute, bilaterally equal. With 6 to 12-year-old, it is 75 to 100 beats, 120 beats per minute, while in 1-year-old to 6 years old, it is 80 to 140 beats per minute, while for fetus, newborn to 12 months, it is 120 to 160 beats per minute. We have also to monitor the respiratory rate. For the adults, the normal will be 16 to 20 beats per minute, regular Yupnik, or that is your normal respiratory rate, and equal rate and depth. But with 1-year-old to 5-year-old, it is 20 to 40 breaths per minute. With your blood pressure, right and left arm, sitting and recumbent. 14-year-old to adulthood, it is 90/60 to 140/90 millimeter of mercury, and the average will be 120/80 millimeter of mercury. The difference of your blood pressure between arms will be 5 to 10 millimeter of mercury, while the systolic pressure in your lower extremity will be 10 millimeter of mercury higher than the upper extremity. From the lying to standing, the blood pressure falls by 10 to 15 millimeter of mercury with your systolic, and 5 millimeter of mercury increase in diastolic pressure. So what consists of your health assessment? Your nursing health assessment or your health assessment consists of our nursing health history and the physical assessment or examination. With neurological cases, this require a separate assessment of your neurological function. So, I would also like to differentiate between the medical and the nursing assessment. With the medical assessment, this will target data pointing to pathologic conditions, while in your nursing assessment, it focuses on the patient's responses to health problems. We have also the different positions that the client will assume. The several positions are frequently required during your physical assessment. It is important to consider then the client's ability to assume a position, the client's physical condition, energy level, and the age should also be taken into consideration. So, we should note down that some positions are embarrassing and uncomfortable, and therefore, it should not be maintained for a long period of time. The assessment is organized so that several body areas can be assessed in one position, thus minimizing the number of position changes needed. We have the different positions. We have the sitting position, which is back unsupported and legs hanging freely. The areas to be assessed will be the head and the neck, the back posterior, thorax, and lungs, anterior thorax and lungs, heart, vital signs, and the upper extremities. The rationale will be providing full lung expansion of lungs, and provide better visualization of symmetry of bodies. The limitation for this position is the physically weakened client may be unable to sit, so the examiner should use the supine position instead, with head of the bed elevated. Another position will be your supine, or that is your dorsal position. That is your back lying position without pillow. And the part that will be assessed will be your head and neck, anterior thorax and lungs, breast and axilla, heart, abdomen, extremities, and pulses. This is the most normally relaxed position because it prevents contracture of abdominal muscles and provides easy access to pulse site. If the client becomes short of breath, the examiner may need to raise the head of bed. Another position will be your lithotomy, or your back-lying position with feet supported in stirrups. In female, we could assess the genitalia and the genital tract. This provides a maximal exposure of the genitalia and facilitates insertion of vaginal speculum. This is an embarrassing position and uncomfortable, so that the examiner will minimize time spent with the client. Client should be kept well draped. Another position will be your Sims position, or your side-lying position. This is the position where you're going to expose the rectum and the vagina. So, in this position, we have the flexion of the hip and the knee, which improves the